Welcome today to this presentation sponsored by mmlearn.org at Morningside Ministries. My name is Spencer Brown. I am a gerontologist and an aging life care manager, and the topic that we're going to discuss today is regarding personal care homes, living options for older adults. What are they, and pros and cons? My background is a nursing home administrator, and many people understand that there are a number of living options for adults. And I'm going to give an overview of those options and then talk a little bit more specifically about some non-traditional living environments called personal care homes. The purpose of this presentation is to define what a residential care home is, which may be also called a personal care home. People get confused about what is assisted living, what is nursing home, what is memory care, different terminology. So we're going to talk about terminology that means sometimes different things in different states. It may mean different things to different professionals or family members that are looking for loved ones. In this presentation, we're also going to talk about what some of the licensed options are for senior living or adult living, as well as some of the unlicensed settings, being personal care homes. And there is a difference. We're going to talk about, when we get down to what personal care homes is, the unlicensed, very small, intimate type setting. We're going to talk about what you should look for, some of the tips to look for. This will not be an all-inclusive list, but it will be a helpful introduction to you of what to look for. And finally, we will talk about, when evaluating these unlicensed personal care homes, what are some of the pros and cons, the advantages and disadvantages that you might consider. So let's just jump right in. Definitions are often important, but I don't want to get hung up on what words we use completely. Residential care home really refers to any residential environment where adults live, room and board. Specifically for this presentation, residential care home refers to something that is smaller in number, that caters to a smaller number of people. It's not your 120, 300 bed, 3-story building. This may be a place that might even be in your own neighborhood and you might not know it. Residential care homes typically offer several of the same type of services. One is room and board, a roof over your head, a bed to sleep in, those kinds of things. 3 meals a day is often and routinely provided, as well as assisting people who live in the residence with daily living tasks. You may be familiar with ADL's, activities of daily living, helping someone with bathing, helping someone get from the bed to the chair to the toilet, helping someone walk safely from point A to point B. Those are services that are provided typically in a residential care home. And in different states, terminology could change, and licensure or unlicensure could be at play. And most people know that nursing homes are regulated, but not everybody. Some people don't understand that there can be licensed and unlicensed options. And in Texas, where I live and have worked for the past 21 years, the requirements may be very different and are very different than California, and may be very different than Florida or Rhode Island. It's very important to consider the requirements of each state, and also what the vernacular, what the language is in that particular environment. So, for example, residential care home could be called a group home, a group care home, a personal care home, which is what I'm going to refer to more consistently during the presentation, board and care home. And so sometimes people will use these words interchangeably, and not everyone has the same understanding of what they mean. I highlighted and put in all capital letters personal care home because that is the terminology that I will try to consistently use throughout this presentation. When it comes to talking about licensed or unlicensed, just a brief overview might be helpful. In the state of Texas, if you provide personal assistance with activities of daily living, if you're helping someone bathe, or you're helping them feed, eat their meals, or you're helping them in the shower, if you take care of 4, 5, or 105 residents, you have to be licensed by the state of Texas. Other state regulations may vary in different states. For unlicensed criteria in Texas, 3, 2, or 1, those 3 numbers are meaning that you do not have to have a state license. You don't have to meet the state standards to provide that same level of personal daily assistance to those residents. Licensed environments I mentioned briefly include places like assisted living, nursing facilities, places that specialize in caring for people with dementia. That's often called memory care. People are more familiar with some of the traditional licensed settings. When it comes to unlicensed residential living for adults, retirement communities fit this category, independent retirement communities that may furnish apartments, and they might be more apt to be subject to the Fair Housing Act rather than state and federal regulations for healthcare facilities. And personal care homes is the other type of unlicensed, where I'm going to spend the majority of my time today talking for. Now, looking at personal care homes, I've given you a brief overview of some of the residential care options. Now I'm talking specifically about unlicensed, which means in Texas, 3 or fewer residents living there where personal assistance is being given by personnel. What to look for. The first thing that is very important is look at the person's level of needs, physical needs. How independent is that person in being able to eat, dress themselves, walk from the bedroom to the bathroom, get up out of the chair safely without assistance. Those kinds of physical needs, those are very important. Also looking at the person's cognitive needs. Very often the body works just fine, and I might be able to walk from here 200 feet, but I may forget when I get there that I'm there for a meal and what the utensils are for. So my brain may be changing. So cognitive needs are important. The second thing I would think is very important to look for is the experience and qualifications of the ownership of that particular personal care home, qualifications of the staff, the personnel that actually work hands-on with each and every resident. One comment about this, in senior living, in adult living, licensed settings like nursing homes and assisted living facilities, there may be a corporate owner that has locations in many states. When it comes down to an unlicensed personal care home where you don't have to meet those state requirements, it's very important to look at who are the owner or owners of that community and what are their qualifications, because they may not have the same level of credentials. Doesn't necessarily mean they aren't capable. It just means there's a different level of qualification. And staffing level on site. In nursing homes, in traditional healthcare settings, you might have registered nurses and other licensed nurses. You might have certified nursing assistants, people that have gone through some formalized training on how to care for adults with disabilities or elderly adults. In personal care homes, that may not be the case. The personnel you want to be sure is capable and competent to provide the care, but they may not have the credentials behind their names. And sometimes that could be a deal breaker for families when they're looking for an option for their family. The third thing I encourage you to look for is for medical personnel available. Many people choose a personal care home because it's not a typical medical model. There's not people in scrubs or stethoscopes walking around all the time, but yet usually there still are medical needs. There are still medications to be given and be tracked. There are still doctor's appointments and medical personnel involved. So ask about medical personnel that will be available there to take care of the residents that live in the personal care home. The other thing I suggest people look for is the type of staff. I hinted at this a little bit, but let me dig a little bit deeper. The type of staff. Their direct care staff. Is there a nurse on call? There may be a nurse owner that lives on site that comes over from time to time. You want to look and ask about the types of personnel on site. And you also want to talk about the type of staff and services provided on site or off site. When people move to a personal care home, they can go to their doctor's appointment, just like you were living at home if they're able. They might go to their podiatrist or the dentist. They might go to other things, for example. So looking for those services off-site, because even in a residential care setting like a personal care home that's unlicensed, having that knowledge of what can be provided here and off-site are important. Financial considerations are always important. And people have budgets. People need to understand that Medicare is not a payer of long-term residential care. And so looking at financial considerations is important. We've talked a little about what to look for. And again, I mentioned it's not all-inclusive. Some of the advantages, some of the reasons that people choose to consider a personal care home or place their loved one in a personal care home. One is, I said, it's smaller. It's a more intimate setting. You might be surprised if you drive around your own neighborhood, wherever you live, wherever you're watching this video, you might be passing an unlicensed personal care home that looks like a traditional family dwelling, a home in your neighborhood, and not even know that there are three, two, or fewer residents living there with care being provided. So people like it because it's small, it's more intimate. It's in a home-like setting that has a dining room where everyone eats together, has a living room. The other advantage people often see is sometimes there is a higher staff to resident ratio. When you just have such a few residents, you don't have a whole lot of staff that are working and walking around there. So you have a lot less activity, a lot less noise. It's more home-like, people will say. So higher staffing ratio. If you have 3 people, you know you have at least one person that's going to be there. In typical nursing homes and assisted living, you don't have a 1-to-3 ratio. Cost effectiveness is another advantage, a possible advantage, not necessarily always one. But since a lot of these personal care homes may be owned by a sole proprietor, or even a proprietor that has 2 or 3 homes, there's not as much overhead involved with all the administrative requirements. When you are licensed by the state and you have to consider things like being sprinklered, having a sprinkler system for fire emergencies, having different requirements for fire and safety reasons, those are expenses that communities and corporations absorb in their operations. Sometimes it may be cost effective and you can get a good deal in a personal care home. That's why people I've known have chosen that as well. The other advantage I want to discuss briefly is there typically is a little less structure and more flexibility involved. And what I mean by that is when people think about moving from their own home and having to go to a nursing home or an old folks home or a place where they need help around the clock, they don't always dream of being bathed at 7 a.m. because that's what's convenient to the staff. In a personal care home, there might be more flexibility to have a shower at 12 a.m., to have a snack, to have your main meal at 2 p.m. There may be a little more flexibility because there are not as many people living there whose needs are being considered. So a little less structured and a little more flexibility. Again, a lot of it has to do with these personal care homes not being licensed by the state and having regulations, Uncle Sam overlooking. Some of the disadvantages, and disadvantages I realize are advantages for some, I realize that. For some personal care homes, some families see there are actually fewer amenities and services. I mentioned earlier about asking about the types of personnel, the types of services that can be provided in the home itself, or maybe transportation to provide services off-site. There typically may be fewer services and are fewer services and amenities provided on site. You don't have a dietitian there. You may not have a doctor there as often. Those kinds of amenities. So that sometimes is important to people. Another disadvantage for some, or something to consider, is the impact of socialization for people. Now, I personally am more of an introvert, so I don't know if, when I get older, if I'm going to want the largest place with all the happy hours and all the parties and all the happening things. I might want some solitude. One of the things that a personal care home offers is a much narrower number of people in which to interact with. If there's just 1 or 2 people that live there and a couple of people that work there at any one time, you can see there's fewer people to interact than in a bigger place. For some, they love that. For some, it can be a drawback. The third possible con or disadvantage is less individual space. And this could be looked at as with the others as an advantage. Most of these personal care homes do have individual space for someone to have a private room. Not all of these are made from the ground up with the intention of being personal care homes. Some of these residential homes in neighborhoods are retrofitted, so there are very often two people living in a space together. Not always is there an individual bathroom or shower. There may be a communal shower for the whole home with three people. Just think, my family, we don't need an individual shower for every person, so same would apply here. So less individual space could be an issue there. One of the most important things that I think of is the fact that it's not licensed. And being not licensed by the state doesn't mean not good. It just means not licensed, and there's not a licensing authority coming in to ensure that they are maintaining compliance with state and federal regulations. That is an important distinction. And in Texas, as I mentioned, 3 and under, if you're providing hands-on care, you don't need to have a license. If you provide hands-on assistance to 4 or more, you have to have a license. So this is an overview of some of the advantages and disadvantages of these unlicensed smaller communities. I'm aware that people look for information in many places, and so what this slide begins to illustrate is a sampling, a small sampling, mind you, of some resources in places where you could search. As I mentioned, professionally, I'm a part of the Aging Life Care Association. I've listed their website on the slide. These are third-party professionals, predominantly nurses and social workers, gerontologists, and other professionals who help families navigate options for their loved ones. That could be a place to start. There are local organizations in each market, city and state, such as in San Antonio, the San Antonio Residential Care Homes. I listed their website. You might get an idea from there and find something similar in your area. You could do a Google search. More and more people are looking up personal care home, residential care home, board home, homes for the elderly, disabled. There are some key words that are no doubt going to pull up some triggers. And then I would refer you to go back to some of the earlier slides I touched on in terms of what are some of the criteria that are important to look at, and what do you think is important, and what do you think is less important when selecting one of these unlicensed, untraditional, non-traditional homes. There are a number of placement agencies, people who help families find living options and get reimbursed for helping find a place. They don't charge a fee to the families. A Place for Mom is one, nationally A Place for Mom. Senior Advisor. I didn't put on this slide, but caring.com. Caring.com tends to be a resource that has mainly licensed facilities, not so much on the unlicensed personal care homes. But there are placement agencies. And most agencies on aging, all federal agencies on aging, are federally funded. So the last bullet that I mentioned here, you might do a search by Area Agencies on Aging, AAA, and not the Automobile Association, don't get confused there. But area agencies on aging often have resources and referrals to be able to help families that are trying to find some living options, in this case some non-traditional living options. As I conclude, we've talked about the definition of residential care homes and what they are. We've talked about the difference between licensed and unlicensed settings. We've talked about what to look for if you're considering a more non-traditional, unlicensed setting, a personal care home. And we've talked about some of the pros and cons, the advantages and disadvantages that are important to people, recognizing that an advantage for one may be a disadvantage for the other, and vice versa. Finally, I want to talk about one of the resources that applies to me. I'm an aging life care manager, part of a national organization, a third-party consultant that helps with the items you see on the slide, that helps families coordinate and communicate among resources, including how to navigate the options of living for seniors or disabled adults, and communicating that. There is a certain umbrella of oversight that's involved with being a third-party care manager. There's a certain role of advocacy, and really one of the biggest roles that an aging life care manager provides is solving problems and helping families work through these issues. And I have seen, as a nursing home administrator of 21 years, as a gerontologist for that same period of time, families often are seeking how to resolve these issues and how to find the right resources, including looking for people who might be a resource for other resources. And I've just included it as a final slide, just our company's website and a phone number. If you have any questions and you feel like you want to reach out to me, I would be glad to answer your question. I hope that this brief introduction to an unlicensed but yet often sought out residential care for older adults or any adult might be helpful to you in your search. Thank you.